Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or their guests are their own. Enjoy the show.
I'm John Strum, and this is RealTalk MS. It's February 26th, and we have a lot to talk about. I'm still in recovery mode from some extensive oral surgery, and as ironic as it sounds, it's a challenge for me to talk. I'm sort of relearning how to do that, so I hope you'll bear with me for the next few weeks while I may not sound quite the same. Honestly, I even thought about just holding off and not producing any new podcast episodes for a few weeks, but I try to keep everything 100 with you, and there's a lot of research being done, lots of announcements being made, and a lot of news that the MS community should be hearing about. So I decided to just push through this and keep going. And if you didn't catch the last couple of podcast episodes, I'll remind you that what I'm going through right now could probably have been avoided if I had exercised better self-care while serving as my wife's caregiver. Unfortunately, self-care isn't always high on a caregiver's to-do list, but that doesn't mean there won't be consequences for making poor decisions. So if you're caring for a family member with MS, please keep in mind what they tell you right before your plane takes off. Please adjust your own mask and then help others with theirs. And while we're on the subject of caregiving, there's a new caregiver support program that's being rolled out by Fairview Health Services in Minnesota. It's called Caregiver Assurance, and I think this program can serve as a blueprint for delivering the kind of support that can make a real difference for caregivers. My guest on the podcast is Heidi Telschow, the program manager from Fairview Health Services Caregiver Assurance Program. But before we get to my conversation with Heidi, there are a few other things that you should know about. Since the 1970s, it's been estimated that about 400,000 people have been living with MS in the United States. That number was based on a national study that was done in 1975. Well, a lot's changed since the 1970s, especially when it comes to being able to more accurately diagnose MS. And the National MS Society has released a nationwide study that now puts that number, the prevalence of MS in the United States, at almost 1 million, up to 913,925 to be more exact. That's twice as many people living with MS in the United States, and that's important for a lot of different reasons. Understanding that the prevalence of MS is twice as high as we thought it was means that we can better understand and more accurately value the profound financial burden of MS on families and on our communities. Understanding that the prevalence of MS is twice as high as we thought it was means that it's imperative that we focus more research dollars at discovering better treatments and finding a cure. And understanding that the prevalence of MS is twice as high as we thought it was means that there are so many more people living with MS and families affected by MS that need support. This new prevalence number means that there are almost 1 million reasons to do more and do better in our efforts to solve the riddle of MS. And you can be sure that we'll be talking more about these 1 million reasons next week at the National MS Society's Public Policy Conference in Washington, D.C. We talked about this conference in last week's podcast episode, which was just before the new prevalence numbers were announced. And these new numbers will make a difference in the hundreds of conversations that MS activists are going to be having with our elected officials in Congress next week. If you're already on the RealTalk MS mailing list, then you received an email blast about 3 minutes after the announcement of the new prevalence numbers was made. And you also received links to the actual studies that were published in the journal Neurology. If you aren't on our email list, you can head over to our website at realtalkms.com, and on the right side of our homepage, you'll be able to sign up to receive email updates with details about each podcast episode, as well as breaking news that you'll probably want to know about. I can give you my word that your personal information is safe. It won't be sold, shared, or traded, and you'll be among the first in the MS community to know when something worth knowing about, something important, is announced. Well, you can be sure we'll be talking more about the impact of this announcement in the weeks and months to come. And if you'd like to take a deep dive into the details of the study and its methodology, I'm going to include links in today's show notes to the 3 research papers that detail the findings that led to this new MS prevalence number being announced. Last month, Dr. Aaron Boster was a guest on the podcast, and we talked about how important it was for people living with MS to understand that there are 2 very different approaches or philosophies that neurologists tend to rely on when they prescribe MS disease-modifying therapy. One approach is the induction therapy model, and the other is the escalation therapy model. The induction therapy model dictates that you begin treatment with the strongest possible medication, even if it has more risk or potential side effect associated with it. The escalation therapy model dictates that you begin treatment with the safest, lowest risk medication, and should it prove not to be effective, well, then you move up to a stronger medication that may carry some additional risk. Well, last week, a research team in the UK published the results of their study where they looked at the long-term outcomes, specifically the change in disability scores after 5 years of treatment in patients treated early with a more intensive disease-modifying therapy or the induction therapy model, compared with patients who were initially treated with milder disease-modifying therapy or the escalation therapy model. The study involved 592 MS patients, 82% of whom were given a prescription for MS disease-modifying therapy. Now, 17.6% were initially treated with a more intensive, high-efficacy disease-modifying therapy like Lemtrada or Tysabri, and 82.4% were prescribed a more moderate treatment like Avonex, Copaxone, and Aubagio. At the end of 5 years, the patients who had started treatment with more intensive MS disease-modifying therapy had a better outcome than the patients who had started a more moderate course of treatment. The patients who had started treatment with more intensive MS disease-modifying therapy showed less of a change in their disability score. Now, I think this is news we can use. If you happen to miss my conversation last month with Dr. Aaron Boster, I'm going to highly recommend that you go back and check out episode 74 of Real Talk MS. I'll include a link to that episode in today's show notes. In our conversation, Dr. Boster explains why it's important for someone living with MS to know whether their neurologist is a follower of the induction therapy school of thought or the escalation therapy school of thought. It's going to impact which disease-modifying therapy you're prescribed. And this research from the UK underscores the importance of having that sort of conversation with your neurologist. It's just something you do because you're an informed medical consumer and you're an active participant in your MS treatment. And if you want to share the details of this study with your neurologist, I'll include a link to the study in today's show notes. LifeBulb is a patient empowerment and innovation platform that's focused on chronic disease. And along with pharmaceutical company Celgene, they're holding an innovation challenge in MS. The challenge is open to U.S.-based innovators working on solutions beyond therapy to help address either challenges faced by people living with MS every day or address an unmet need that could potentially improve outcomes and experiences for both people with MS and their support partners. The competition is free to enter with only a couple of requirements. First, the applicant must have a personal connection to MS, so you have to be someone who's affected by MS as a patient, a loved one, or a support partner. And if you're selected as a finalist, you must be able to attend the live challenge event that's going to take place at Celgene headquarters in Summit, New Jersey this June. That will be an expense-paid trip, but you have to be able to make the trip. The winner of the challenge will receive $25,000 as a monetary grant, and if you're interested in entering, I'll include a link to the application in today's show notes. Applications must be submitted online by 11:59 p.m. Eastern Daylight Time on April 12th, 2019. So if you have an innovative idea for addressing a challenge or an unmet need for people affected by MS, here's an opportunity to take the first step in turning that idea into a reality. Speaking of entrepreneurial innovation, a lot of you have expressed an interest in the role that cannabis-based treatments might play in managing MS symptoms. And in previous podcast episodes, we've talked about the work that MMJ International Holdings is doing in developing a cannabis-based treatment to manage spasticity in progressive MS. As MMJ International is readying 2 clinical trials designed to test its pharmaceutical-grade cannabis-based medications as viable treatment options for MS, the company has requested that their cannabis-based therapy for progressive MS be fast-tracked by the FDA. The FDA's fast track expedites the review and approval of experimental treatments for serious or life-threatening diseases with the potential to fill previously unmet medical needs. And I'll keep you posted as MMJ provides further details about the status of their proposed treatment. While we're talking about unmet needs, too often MS caregivers are faced with a number of unmet needs, and sometimes it's not that there aren't solutions or there isn't any support available. It's just that caregivers don't always know how to navigate the social safety nets that may be available to them. So they aren't able to take advantage of the kind of support that is available if you have the time to look and know where to look for it. That's where a new caregiver support program called Caregiver Assurance comes in. And I think this program may define the very best way to connect caregivers with the support that they need when they need it most. In a moment, we'll meet my guest, Caregiver Assurance Program Manager, Heidi Telschow. As my wife's caregiver, I think I have a pretty clear understanding of some of the challenges that caregivers face. And my opinion is that no matter what the challenge may be, financial, emotional, or just trying to find the right resource at the right time, every caregiver challenge is made worse by that feeling of isolation that so many caregivers experience. It's that feeling like you're the only one who can figure out a particular problem or find a particular solution to a problem. Well, Fairview Health Services, one of the largest medical care organizations in Minnesota, has launched a service that's designed to ease the burden that a caregiver may be feeling by connecting that caregiver to resources that can provide them with support. The program is called Caregiver Assurance, and my guest today is Heidi Telschow, Program Manager and a Caregiver Advisor from Fairview Health Services Caregiver Assurance Program. Welcome to the podcast, Heidi.
Thank you so much.
Maybe you can start us off by describing what the Caregiver Assurance Program is and how it works.
Sure. So the development of the Caregiver Assurance Program through Fairview actually began over 3 years ago as a joint effort between Fairview Product Development and Fairview Senior Services. And I think the major push for a program of this nature was really validated by market analysis as a whole. Research being completed in the area of caregiving and the projected growth of the baby boomer population. Fairview also took into consideration the sandwich generation, those that are still caring for their own family members at home as part of that immediate family while also taking on caregiving responsibilities either with their parents or a spouse or elderly family members. And so, like you had mentioned, John, we see that this population experiences additional mental, physical, and occupational stress due to their caregiving role and responsibilities. And so the program was initially launched in November of 2017, and to date we have served over 45 members. So that's how the program was born, so to speak. And what it is, essentially, is a program, a membership-based program that connects caregivers of any background with a dedicated caregiver advisor, a professional licensed social worker who understands the healthcare system, has an appreciation for caregiver, and knows resources that might be available, and really developing a relationship with them one-on-one so that that caregiver has a central point of contact for them to navigate their caregiver journey outside of appointments for their loved one or the things that their loved one needs on a day-to-day basis.
So what was it that motivated Fairview Health Services to develop Caregiver Assurance?
I think that much of the thinking behind the program was inspired by the need for these caregivers that I've mentioned to have a central point of contact to meet their needs, assessing what services are available to them and their loved ones, how they can incorporate good self-care into this busy season of life that they're doing, and to have a safe place to process change, receive support, and sometimes just have their experiences validated that, caregiving is not easy. It is very much a juggling act. And I think Fairview as a whole felt that the program has been accepted very well based on the growing need for caregivers to have this kind of support. And one of the ways that we're seeing that is in the workplace. If you are an active caregiver who is caring for somebody on an ongoing basis, that can affect your productivity and efficiency at work if you're needing to take time out of your day to meet those needs, needing to take time away for surgeries or family leaves and things like that. And I think that Fairview wanted to address that issue in giving caregivers that support.
How have caregivers reacted to the program?
Sure. So to date, the feedback that we have received has been incredibly encouraging because we're a new program and because we're trying to tailor it and make it the best fit for caregivers as a whole. We've done a lot of surveys, a lot of questioning to our members on an interval basis. So we usually speak with them at time of enrollment, take a look at how they're doing 3 months in, and maybe when they end their relationship with us and maybe the impact that this type of service has had. And many of those that we speak with seem to understand the need for this type of support, feel that you don't really understand what it is to be a caregiver and have that bleed into all areas of your life unless you've actually done it yourself or been close to somebody who has. So as we continue to grow this new program, we know that feedback is incredibly important. We want to hear that from our members and what they're needing. And we want to know that we're helping them feel supported, that we're helping their stress and burden levels decrease. And we want to know that they would recommend this type of support to others. And at this point in time, 100% of our members via survey have said that they have felt that way and that they would recommend it to someone else in the same situation.
Well, I think that's just a great report card to have received already. You mentioned the pressures that caregivers are sometimes under as they try to juggle and balance their caregiving responsibilities with their responsibilities at work. And I'm wondering if you've received any feedback from employers.
We have actually. We are currently offer the program to a local insurance company, and Caregiver Assurance has supported a number of their employees there. And in speaking with them at health fairs and getting feedback from upper management, they are able to see a change. They're able to see people getting their needs met at a central point of contact, maybe not having to take so many days away from work, not feeling worried at work about trying to fit in those appointments or things throughout the workday, and that people's overall quality of life and contentment at work is definitely increased. And so those are the type of things as we grow this program that we'll be looking at possibly selling this product to employers so that they could offer it as part of their benefit package. And we think that the growing rate of caregivers, the aging population, the need for this, and the numbers that we saw in the market analysis, we think that that's a great way to support this population and hope to grow that in the years to come.
Well, I know there are going to be a lot of MS caregivers who are carefully listening to everything we talk about, Heidi. I just think that Fairview Health Services deserves all the credit in the world for really blazing a trail into an area that is so often overlooked, providing support to a population that is just grossly underserved. And I guess it's because of my own experience as a caregiver. I always try to look at the role of a caregiver like a weather front. And when that caregiver is calm and sunny, I think it not only allows them to give the best possible care, but that disposition, just walking into the room, helps the person they're caring for have their best possible day. So it's really a win-win. And I just think what you guys are doing is amazing. It can only get better as your program continues to evolve. And having said that, maybe you can share with us what's next for Caregiver Assurance.
Well, like I said, I think we would like to bring it more into the employer space so that it is part of maybe the yearly benefit packages that the workplace offers, specifically if they have people, a large number of employees in that sandwich generation age range that is providing that sort of care. So I think that's the biggest area of growth. We also piloted it within our own company, so offering the service to Fairview employees and then getting a lot of that really rich feedback from them since they themselves work in healthcare. And I think it's really fascinating to see doctors, nurses, physical therapists, people that are already embedded in the healthcare system who are still finding this is a very valuable service for them. They do this work every day, but they also care for somebody outside of their work hours. And even being embedded in the health system does not mean that you know everything or know which resource to reach out for or contact, and that having this advisor who knows them, who walks that journey with them is such a valuable piece. And so I think that's next steps, certainly for Fairview's Caregiver Assurance Program.
Well, I think that this program begins to answer a need that's only going to grow as people continue to age and medical science continues to find ways that enable us to live even longer. Heidi, I want to thank you for all of your efforts to get this program launched and to make it a success. And thanks for taking the time to talk with me today.
Oh, you're so welcome. Thank you so much for having me.
Well, that's going to wrap up this episode of Real Talk MS. Just a reminder that your feedback, your questions, and suggestions for future podcast episodes are important to me. That's why, in addition to emailing me at john@realtalkms.com, that's JON@realtalkms.com, you can also call the special listener hotline that I set up specifically to capture your comments and suggestions. Just call area code 310-526-2283 in the United States and share your thoughts. So whether you choose to shoot me an email or make a phone call, I hope you'll get in touch and join our conversation. My name is John Strum. Thanks for listening, and we'll catch you next time.